I press stop. Alright. NIH scale. I'll touch the button again. The room. Camera. It's my NIH scale. Ishihara. Alright. Hello, sir. My name is Alicia. I am going to be your nurse practitioner for today. How are ya? Good. I'm so glad to hear it. We are going to be doing a complete head-to-toe physical on you today. Get the angle straight. So the nurse says that you're here because you kind of got a stiff neck. That's been going on for about 2 or 3 days. I have washed my hands and provided privacy. I am reviewing the vitals that the nurse obtained. She said your temperature was 98.9, your heart rate was 88, your respiratory rate was 16, blood pressure was 120/80, height of 59, 5'9", weight of 220, so makes your BMI 32.5. So because you do have that kind of stiff neck, we are going to be looking at that a little bit in your complete head to toe. So for your head, we are going to inspect. We are making sure there are no lesions, no lumps, no bumps. Your eyebrows are evenly dispersed. Your eyelashes are everted. Your hair is evenly distributed. Your outer eye canthus is level with the top of your ears. Your eyes are clear. So now we are going to move on to palpation. Just let me know if anything hurts. Does anything hurt? No. All right. If there would, I would document it. I'm going to feel his temporal pulses. They're about a +2 bilaterally. There's no cording. Any tenderness here?
Nope.
Open and close your jaw for me. So his TMJ joint, there's no cracking, there's no crepitus. I'm going to palpate your sinuses. Let me know if there's any pain. Any pain?
Nope.
All right. So that is part of your face. So next I'm going to assess your cranial nerve number 7, your facial nerve. Can you smile for me? Can you puff out your cheeks? Can you raise up your eyebrows? Good. So that's cranial nerve number 7. That's the motor aspect. There is a sensory aspect to it. I just gotta get my sharp stimulus and soft stimulus. Oh, there we are. All right, I'm gonna have you close your eyes, and I want you to tell me if you feel sharp or soft. Quit wiggling your ears. That's great. All right, eyes closed. I'm going to do it over the 3 main dermatomes on one side, but I would do it bilaterally. Can you tell me what you feel here?
Soft.
Can you tell me what you feel here?
Oh, yeah.
Is it sharp or soft?
Yeah, sharp.
Can you tell me what this is?
That's soft.
Okay. And then what's this?
Sharp.
And so axillary, maxillary, and mandibular. So that was the sensory and the motor component of your cranial nerve number 7. For cranial nerve number 5, I'm sorry, those were cranial nerve number 5s. Number 7 was puffing your face out. So we already palpated. We did the 3 dermatomes. So we did the blunt. We did that. So now we will move on to your eye exam. So I'm looking. It's a little not good lighting in here, but your eyes are clear. Like I mentioned, your eyelashes are everted. I don't see any pink or jaundice. They're enteric. There's no lesions that I can see. And look straight ahead. I'm going to look at the side of your eye. I'm going to look at your cornea. It is smooth. It is clear. It's not bulging at all. It's non-traumatic. So then I am going to get my my light source. All right. So for the light source, oh no, we're gonna assess convergence first. So before we get into your eyes, we're gonna look at the ocular movement of your eyes. So to assess convergence, we are checking cranial nerve number 3. I'm gonna have you look straight ahead and then look at my finger. Good. So his eyes converge and his pupils constrict. And then I'm gonna have you do it again, just look at me. Follow my finger towards your eye. Good. And they converge together. Then I will check your cranial nerve number 2. I'm going to have you hold this. This is a Snellen chart. Could you read this line here for me?
D E F P O T E C.
Perfect. So that means he has 20/20 vision. Next, I'm going to check. Oh gosh. Your peripheral vision. So I'm just going to do it on one side. So I'm going to have you cover your eye up with the chart. Oh, no. Well, yeah, it works. And then I'll cover my eye up with the chart. So I want you to tell me when you see my hand in your peripheral.
Yep. 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 Yep.
Okay. And go ahead and put that down. All right, we'll do the Ishihara, the colorblind test. Ishihara. Tell me what number you see.
12.
What number?
8.
What number?
6. 29. 57.
Oh, that's an ad, but good. You do not have any color blindness. So we checked visual acuity. We did confrontation. To assess confrontation again, just follow my hands. Don't move your head. You good? All right,
Mhm.
good, excellent. Alrighty, and then we we'll check the pupillary reaction. Oh gosh, on my eyeballs. So I'm gonna look for direct and indirect. So I'm gonna shine the light into his left pupil, and I'm gonna see what happens. They're about a 4+ right now, and they constrict to about a 2. And then I'm going to do an indirect. I'm going to shine, but I'm going to look at the right side and make sure that that pupil constricts as well. Okay. Constriction, visual fields. And then I'm going to assess cranial nerve number 5 for the red light reflex. I'm going to shine the light on the bridge of his nose and observe if his pupil fills with an orange glow. And they do. Beautiful. So next I'm going to do my fundoscopic exam. I'm going to look in his eye, and then your conjunctiva are beautiful. Oh, I'm doing the wrong one, silly. Alright, don't squint. You want me to do the other eye? No, don't squint. I know it's bright, but I gotta look in the eye stuff. Alright. So I'm getting in there. I can see. There we go. I can see his vessels and his veins, his macula and his optic disc. His macula is kind of gray over to the temporal area, and his optic disc is more towards his nasal aspect. His arteries and veins are about a 2-to-4 ratio. The arteries are a little bit darker than his veins. There's no cotton wool. There's no nicking that I can see. Oof. Made me blind. So then next we are going to we did convergence, we did 3, 4, and 5, we did your pupillary recheck, we did your cornea, we did your optic, we did your ocular motor, we did your trigeminal with the Hirschberg. checked your conjunctiva, right? Look down and then look up. Perfect. We'll move on to your ears. We're gonna inspect. They are pink. They don't have any lesions, no masses. I'm assessed bilaterally. They look very symmetrical. There's no deformities that I can see. I'm gonna palpate. Any pain?
No.
I'm gonna do his maximum process. Any pain back here?
Nope.
If there was any pain there or in his ears, outer ears, it could be indicative of an outer ear infection. So next we are going to look in your ears. So we'll get my light source for that. Take a peek in there. We're gonna do it on one side, but if it was a real person, and not that you're not real, we do it on both. So we're gonna go up, down, and back. We're gonna advance this. He does have cilia. There is no cerumen in the external ear canal. His tympanic membrane is kind of a silver pearlescent. The light reflects at about 5 o'clock. It's not bulging. There's no fluid. I can see his inner ear structures, so that's nice. Next, we are going to assess cranial nerve number 8, which is the vestibular cochlear. First, we're going to do the whisper test. So, could you cover your left ear for me? I'm going to whisper a sentence and tell me what it is. It's nighttime.
It's nighttime.
Beautiful. And I would do so. You can take your hand down. And I would do so bilaterally if we had time. Next, I'm going to assess the Weber test. So with my tuning fork, I'm going to check for lateralization. So I'm going to whack it, put it in the middle of your forehead, and then you tell me if it goes both ways, the vibration or sound, or if you feel it. Is it pretty even?
Yes.
Good. Now I'm going to do the Rin test, which assesses for bone and air conduction. So I'm going to stick it on your maximum process back here. Tell me when you can't hear it anymore.
Can't hear. Hear.
Okay. So that is a normal finding. That means that his bone conduction is air conduction is greater than his bone conduction, which is a normal finding. So we will move on to your nose, because H-E-E-N. So I am looking to make sure his septum isn't deviated. I'm looking at his nasal folds. There's no drainage. There's no masses. There's no lesions. And there's no lumps or bumps. So I am going to use a light source again. I'm going to look at it, check his turbinates, stuff like that. Tip your head up. And then his turbinates are small. They are pink in color. If they're blue, it could be like allergic rhinitis, which he does not have. I want to do the patency test, so I'll have you close one side of your nose and breathe. Beautiful. Hand down. Other side, breathe. Beautiful. So both sides are patent. I'm going to have you close your eyes now. We're going to assess optic nerve number 1. I'm going to have you smell something and you tell me what it is.
Cinnamon.
Yes, it is cinnamon. Alrighty. So next we will move on to your mouth. So I'm looking at his lips. They are pink. They are intact. There's no lesions. There's no lumps. There's no bumps. They're very symmetrical. I'm gonna have you open your mouth. I don't see any lesions. Oh, I forgot gloves, but he's my husband and my hands are clean, so I will look in his mouth holes. So I'm gonna look. I see his dentin ducts, which are on his second molar. I'll have you stick your tongue out. We're gonna assess cranial nerve number 12. There's papillation. There's no coating on there. Can you move your tongue side to side? Good. Open your mouth wide. Say ah. No, leave your tongue alone. Say ah. Good. His uvula, his soft palate, and his hard palate all rise and put your tongue in your mouth. All rise in the same time. There's no deviations. His tonsils, they do not extend beyond the pillar, so they're probably about a +1. I will assess for lesions. Open your mouth, stick your tongue out. I'd feel the lateral border, but I would wear gloves. There's no lumps, there's no bumps. And then underneath, lift your tongue up for me. His Wharton ducts are patent. There doesn't appear to be an issue there. His teeth are in well order. Stick your tongue on the side of your cheek. And again, good. His musculature is good. I wash my hands because your mouth is very gross. Alrighty. So that was your tonsils. Nope, that was your head, your eyes, your ears, your nose, now your throat. So to begin with his throat inspection, I will palpate his lymph nodes. So I will start with his occipital lymph nodes. I'm going to go around in a circular motion and then move forward to the postauricular, to the preauriculars, to the submandibular, to the submental, going down to the anterior cervical, and again to the posterior cervical. Go ahead and shrug your shoulders a little bit, and getting into the clavicular. Nothing there. All right, put your shoulders down. Good. That's accessory nerve 11, FYI. It's normal, it's symmetrical. Go ahead and swallow for me. And again, his thyroid rises up and down when he swallows. His trachea is not deviated. It looks good. There's no jugular vein distension that I can note. So I will listen for any carotid bruits. Oh, let me palpate them first, please. We'll do it one at a time, one side, so you don't pass out. And they're about a +3. So I'm going to have you exhale and hold the breath out for me. Good. There's no bruits, no thrills, nothing like that I can apprise. So that is his neck. And so I will move on to the RCAT and sensory RCAT sen. So I'll have you remember 3 words. They're going to be apple, penny, and bed. Apple, penny, bed. Got it? Mm-hmm. Okay. So remember that because I'm going to ask you in the middle to see what your short-term memory is, okay? All right, slide this down. So I'm looking at his anterior chest. It is very symmetrical. There is a light disbursement of hair. There is no, oh my God. I don't see any strange movements, I should say. And then I'll have you have your legs off the side. I'm going to assess your back half. Good. Alrighty. So, on the back half, we are going to look. It's very even. There's no lesions, lumps, or bumps. He does have a scar and a mole. And so we will inspect, and then we're gonna palpate next. Any pain?
Nope.
No. Alrighty. Any pain? I'm gonna
Nope.
chest for the CVA. And then we will percuss. And so it's kind of a dull resonant sound. There's no real tympany noted. If there was, we would be looking at consolidation. So I'm going to check tactile pheremetus. Can you say 99 for me?
99.
Again?
99.
Again?
99.
And again?
99.
All right. So I was feeling vibrations up here that kind of disperse when we go down lower. So I'll auscultate his breath sounds. I'm going to go a little bit faster than I would for a normal exam. Stop laughing at me. Take deep breaths in, please. Sorry. Again. Good. So I hear just normal lung sounds. I don't hear any rhonchi, rales, or wheezing. I'm hearing kind of bronchial vesicular sounds up here and going down into vesicular sounds. They're kind of quieter. They're not diminished by any means. So I'm going to listen for bronchoscopy. I'm going to have you say 99 again.
99, 99, 99, 99, 99, 99.
Good. So I hear it louder up here, and it kind of diminishes as we go down, which is good. If it was louder, or if it was a more of a resonant sound, then we would be looking again at consolidation. So now I'm going to listen for egophony. So can you say E?
E.
Again? Yep.
E. 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 E.
Good. So I heard E throughout. I didn't hear any other adventitious sounds. If it went into like an A sound, then it would be more of a consolidation finding again. So next I am going to do my move the cinnamon. Do my diaphragmatic excursion. I would do it bilaterally, but for sake of time, we're going to do it on one side. So I'm going to palpate. No, sorry. Take a deep breath in, and then blow it out. No, just hold it out. All right, breathe in, and then blow it out. Alright, so normal diaphragmatic excursion is about 4 to 6 centimeters. And you're about 6. Good. I'm going to assess lung rise. So sit up straight for me. I'm going to push my hands together. Take a deep breath in. And blow it out. Good. Again. And out. Okay, good. So that is symmetrical. We attempted to elicit the CVA tenderness, so I will make note of his dimensions. Sit up. There we go. So it's about a 2 to 1 from his posterior to his anterior view. So, well, you can put this on, but then kind of turn back around so I can get to your anterior chest, please, and thank you. Huh? What? They seen your butt? You forgot your words? That's okay. Alright. So, on the anterior aspect here, pardon me. My back hurts. Alright, anterior chest. So, I'm going to drop that down. Again, I had already inspected it. Next, we are going... Okay, we'll palpate. Any pain?
Nope.
Okay, good. Inspect, palpate, listen. So, yeah. I'm going to listen to your lung sounds up front. Again, I'm going to do it faster than I normally would. Breathe in. My bad. Jeremiah? Indica? Good. So there was no wheezing, no rales. I got kind of more of a bronchial sound up here and then more bronchial vesicular down here. About right here is where I'm hearing his right middle lobe. I'm going to do tactile pharyngitis. Can you say 99 again?
99. 99. 99.
Good. So that's normal. We're going to observe for any movement on your chest from your heart, which I don't see. And so I'm going to listen. I'm going to listen to all 5 main points. Your aortic, which is your, over here, but on this side for his right middle lobe. Right second, next to the sternum. left intercostal space for his aortic, down one for the herbs, and then down another for tricuspid. Excuse me. And then midclavicular line below his nipple, fifth intercostal space, essentially for his point of maximal impulse. Alrighty. So I'm cross your eyes, please. I'm gonna listen to heart sounds. I'm gonna assess for any extra any other sounds. So second around the right, second on the left, third on the left, fourth on the left, and then I'm going to use the bell, and I'm going to assess for specifically his aortic and his mitral valve. So for the aortic valve, I'm going to have you lean forward for me. I don't apprise any murmurs. And then I'm going to have you go off and over to the left to listen for the mitral valve, which I don't hear any murmurs either. So that is good. Oh, yeah, like that. I'm trying to figure out if I need to do anything else on your chest. Yes, I mean. So I think we're good to move on to your abdomen now. So let's pull this up. Providing for modesty. Alright, and then go ahead and lay down for me. And kind of scoot your bottom up just a little bit more for me. Alright. Oh, crap, you're too tall. Jesus, fuck. Oh, sorry, I didn't mean that. My stethoscope. Alright, so, and my marker and my... Alright, so we're going to inspect. There's no lesions, there's a fine disbursement of hair. Do you have any pain in your belly?
Nope.
No. Alright, so I inspect. Now I am going to palpate. No, we're going to listen first because we don't want to mess up your gurgly sounds. And I'm hearing clicks and gurgles all the way along in all four quadrants. Good. And then, since I have my stethoscope out, I'm going to listen for his aorta, his aortic, good, and then renal arteries. Alright, I'm going to feel for pulsation, and I'm going to try to assess his aortic diameter. Okay. And that is about 2 centimeters, which is normal. So I don't find any dilation of his aorta. I am going to percuss his belly, try to hear all sorts of fun sounds. So I'm hearing some dullness, some tympany. Especially his bladder is tympanic, his gas bubble is as well. So tympany is really where there's air is, and dull is where you would expect to find like an organ mass or something. I'm going to assess where his liver is. So we're going to percuss, and it's going to go from a resonant sound to a kind of dullness. The normal liver span is about 6 to 12 centimeters. And I got him at 8.5. So next I'm going to try to feel his liver. I'm going to use the hook method. I'm going to have you take a deep breath in. And then I'm going to hook my fingers underneath his ribs and breathe out. And I don't even, maybe a little bit, feel the edge of his liver. So no organomegaly there. And then for the spleen, I'll work from the umbilicus up to the left, because if it was going to be enlarged, that's where it would be. And I'm not feeling anything. I do assess his gas bubblegum. While I'm down here, I'm going to assess his inguinal lymph nodes. Don't giggle. Both horizontal and vertical. Horizontal, vertical. I don't apprise any hernias or lymphadenopathy. Next, I'm going to do the Berger's test. I'm going to have you lift your leg up in the air, bend your knee, roll your ankle around a little bit. Alright, we're trying to get the blood out of your ankle. And then give me your hand. On the count of 3, we're going to sit up. Give me your hand. And then 1, 2, 3, sit up. And then we're going to look for the change in leg color. This is assessing his peripheral blood flow. Okay. Do you remember those 3 words I told you earlier?
Penny.
Mm-hmm.
Apple.
Yep.
Bed.
Good. You got it. Good job. Yeah. And then, since we're sitting up, we'll do the NIH scale and stuff like that. Alright, so, can you read the first 3 sentences?
You know how down to earth I got home from work.
And then in this, there are a few things wrong. Pick one.
The guy's falling off a ladder.
Good. And then I'm going to assess your judgment. So, say you had to get to Florida tonight. What would be the fastest mode of transportation to get to Florida?
Plane.
Good job. So proud of you.
I almost said teleportation.
You almost said what? No, what did you say? Alright, never mind then. So...
TARDIS, the wrong answer.
A TARDIS is the wrong answer, yes. Alright, so we did the Baker's test. We'll do the Allen's test next. We're going to check for collateral blood flow. I'm going to occlude the radial and the ulnar artery. We're going to look for the hand color to go away, essentially. And I'm going to release one, and pink flush comes back. And then we're going to occlude them both again. And we're going to release the ulnar, and the pink flush comes back. So that's great. So we did the Bakers. We did the Allens. I guess we can assess the Allens. You put your hands together like this, and then push them together for like 30 seconds. Usually it's about 60. If you feel any tingliness, numbness, pain, alrighty. And then I'm going to do the median test. So we'll go over like this. Palpate any pain? Okay, good. So then next we're going to do I was going to have you stand up and do your legs, but let's just do your arms. So we would do both sides. We're looking and we're inspecting. There's no lesions. The hair is evenly dispersed. There is no masses. We will assess for range of motion. So can you open and close your hands for me? So flex and extend, good. Can you abduct and adduct, good. Can you roll your arms and wrists? Okay, good. No, not your arms yet, because we got to work our way up to the elbow. There's no crepitus, nothing like that. So I'm going to have you push against my hand. Alright, and then pull against my hand. Good. His strength is about +5 in his hand. We're going to work our way up to our elbow. We are going to inspect it. There's no redness, there's no masses, there's no lumps, there's no bumps. Any pain when I palpate?
No.
Okay, good. Rats, the wrist. We did the wrist. We inspected, we palpated, and he did the eversion and inversion. Alrighty. And then the elbow, can you raise your arm up? So that's flex. Can you extend? Can you hyperextend? I know it's weird sitting down. Good. And then abduct and adduct and yes, thank you. Any pain or anything with that?
Nope.
Okay, great. We're gonna look at your shoulder. There's no lumps, there's no bumps, there is a tattoo. Any pain in your shoulder?
Nope.
Alright, no crepitus here. So can you shrug your shoulders up? Can you shrug your shoulders down? Can you adduct, then abduct? Good. Shrug your shoulders against my hand. Forgot. And then your pain is good. And then I palpated his muscles and there's no pain there. So next we will do a reflex test. Good. And then brachial. Hold on, then, buddy. There you go. Thank you. And we're just looking for flexing of your bicep. Good. And then let's borrow this arm. You'd be hitting the camera over there. We're gonna do over here, the tendon over here, and check the triceps reflex. Good. Did you feel it? I went. That's great. All right. So his reflexes are a good +2, which means they're normal. They're very brisk, not too brisk though. Alrighty. This is where it gets weird because I gotta do your legs. Let me move the table. So for the legs, we're gonna take his socks off. Just do one foot. He's got about +1 pitting edema there. But otherwise, inspection, there's no lumps, there's no bumps, there's no masses. We can assess range of motion in his toes. Can you flex your toes for me? Can you extend your toes? Can you adduct your toes? Can you abduct and then adduct? Okay. Any pain there?
No.
All right. I'll have you close your eyes, and I'm gonna do some to check your position sense. All right. Close your eyes. Tell me where I'm moving your toe.
Up. Down.
All right. Good. And then with your eyes closed, tell me what you feel.
Vibration. 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 Vibration.
Good. Alrighty. Alright, and then we're going to look at the ankle. Besides that little bit of pitting edema, which is normal at the end of the day, essentially, from his sock. I don't see any lumps, no bumps, no masses. Any pain in your ankle?
Nope.
We're going to palpate. There's no crepitus. There's no real warmth. Alright, can you rotate your ankle for me? Good. Can you flex it and then extend it? Good. Can you abduct, eversion and inversion? Good. No pain there?
Nope.
Alright. His calf is very symmetric compared to the other one. There's no lumps, no bumps, no masses. Any pain in your knee?
Nope.
No. Okay. I'm going to palpate. No pain. Good. Can you extend and flex your knee? Good. Can you kind of turn it in and then out? Good. I'll have you lay back. I'll get to your hips. Alrighty. Any pain? Oh, sorry, love. Was that pain or was that
No.
tickle? Okay.
No, okay.
Alright, no lumps, no bumps, no masses. We're going to lift your leg up.
Yep.
Okay. And then what we got, yep, let's check for your Homan sign. Any pain in your calf?
Nope.
No? Okay. Oh, I forgot to check for a SOA sign. Please hold. I'm going to put my hand on your thigh. I'm going to have you lift your leg up. Is there any pain in your right abdomen?
No.
No. All right. Any pain when I push down and let go?
Nope.
Okay, good. And then arbitrator sign. Bend your knee. And then we're gonna, let me bend your knee. And then any pain?
No.
Okay. So, forgot that on your abdomen assessment. All right, we'll have you sit up. Where'd my reflex hammer go? All right, thank you, sir. We're gonna assess your reflexes. Take your hands and pull them apart for me. Check your patellar reflexes. Pull your hands harder. All right, that's kind of sluggish, so I'm gonna say a +1. Were you focusing on that? You goose. All right, we're gonna check his Achilles. Good. You can relax your hands now. I'm gonna check for your pulses. Radial. Brachial. I'm not gonna do your femoral because then you're gonna geek out on me. We're gonna do the popliteal. That's about +1. His posterior tibialis is a +2. And his dorsal PDS is a +1. No. Please hold. Alright, that one's a +2. Alright. I gotta fix my sock, sorry. Alrighty. I will do the sensory for your body before I have you stand up. Alrighty, so where did my sharp thing go? I'm gonna close your eyes, please. Don't look at my sharp stuff. Alright, I'm gonna touch your major body parts and tell me if this is soft and then this is sharp.
Yep.
Okay. And we would do it on both sides, but
Sharp. Soft. Hard. Soft.
okay. Sharp and soft, they're the same things. Alrighty, so we did that. So then I'll have you stand up and then I'll have you stand there for a few seconds. We're gonna make sure that his legs don't randomly pop out with varicose veins, which they are not. And then we're gonna assess your gait. I'll have you walk towards the window, your normal gait. Ooh, sorry about your fanny. Let me tie your fanny, my bad. Everybody in the world is gonna see your butt now. Alright, and then tiptoe towards me, please. On your tiptoes, good. And then turn back around, walk on your heels. Alright, and then stop, and then tandem walk, so heel to toe for me. Heel to toe, like I do on a sobriety test. Are you goof? Don't be a goof. You need to get your brain checked out. Oh God. Alright, stand still. We're going to assess a Romberg test on you. Close your eyes, stand still. We're going to check and see if you get all swayy on me. No. Okay, good. I'm going to have you turn around. You bend over and touch your toes. I'm going to assess your spine. Have no scoliosis here. Alright, stand up. Any pain back there? I should have asked before I did that.
No.
Okay. Now off to the side. Good. The other side. Good. What about your neck? Can you turn? Oh. Turn your neck. Okay. Good. Alright, hop back up on the bed for me. Oh my God.
You did that.
I did hop. You did hop. You did one hop. You did good. Alright. So you can put your blankie back on, yes. So your muscle strengths, when I was grading them, I forgot to grade them, they're +5. Your reflexes are mainly a +2 besides your popliteal, which is a +1. We're going to move on to sensory. I already did the pain. I did that. I didn't do the vibratory senses on your wrist. All right, close your eyes. Tell me where you feel it. Can you feel it?
Yes. Yes. Yes.
Okay. We did that. And then keep your eyes closed, just like your toes. Where am I moving it?
My thumb up and down. Middle finger up. Middle finger down. Pinky up. Pinky down.
All right, I'm going to turn your hand over. And then with your eyes closed, I'm going to draw something in your hand, okay? Tell me what shape it is.
Circle.
Okay, good. Now I'm going to put something in your hand. So that was, nice to meet you, friend. That was graphesthesia. I'm going to put something in your hand. Keep your eyes closed. And then this is sterography or stera something or other. Tell me what is in there.
Oh, it's a quarter.
It is a quarter. Good job. All right. Now open your eyes. It was a quarter. I took your quarter. I'm sorry. We are going to assess your cerebellar reflexes. So can you flip your hands like this? Do this. All right, good. And then with one hand, touch your nose. With one hand, you goose. All right, so that is good. And then, oh, I forgot to check for Babinski. My bad. Let me borrow your foot, please. All right. It's gonna tickle, but I gotta check your toes. Okay, no, they did. There was a negative Babinski sign there. I did the Romberg. I did the heel to toe. Did I ask you the 3 words?
Yep.
Okay, what were they? Do you remember?
Apple penny bed.
Okay, I thought it was table, but yes,
Could be table.
it could be table. I'm trying to forget if I forgot anything. We're at 46 minutes and can't go over 55. Head. Did I check for the pulsation and the cording? Yes, I did that. I did that. I checked. Oh, cranial nerve number 10. When I was inspecting, I would have made him gag, but I'm not going to do that. And then shrug your shoulders against my hands for me. Good. That's your accessory nerve. Turn your head against my hand. And then again over here. Okay, good. All right, so we did 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10, 11 and 12. Alrighty. I think that's it. I think we did good.